This conference will now be recorded.
Good morning, students. I'm audible to you? Anyone of you?
Yes, sir.
Okay, thank you. So we finished this systemic poisons. The poisons which acts on the specific system and it causes a deleterious effects on that particular system. You can call it the systemic toxins, and especially we finished the asphyxiants and food poisons. What is okay? Now, yesterday class we finished this spinal poisons, especially strychnine, nux vomica, and peripheral poisons, conium and curare. And conium means that is the hemlock. Already finished. So today we are going to discuss about the cardiotoxic poisons. Cardiotoxic poisons mainly you can see oleander. There is nerium oleander, and in that thevesia, cerebra thevesia, tobacco, quinine, aconite. These are especially poisons which acts on the cardiovascular system and which lead to the deleterious effects on the cardiac system by affecting the cardiac muscles as well as the conducting systems. So they may lead to the arrhythmias, tachycardia, arrhythmias, and the heavy blocks, and finally they will be lead to the cardio respiratory failure and death of the individual because of this poisons. So you can remember these oleanders and tobacco, quinine, and aconite are the aconite, otherwise called a monk's wood, under the flowers of that monk's wood will be wood-like. So aconite, quinine, you already know. Oleanders and tobacco. So come to the anal boil is over, and now come to the cardiotoxic poisons. So we will discuss about the nerium oleander. ఇది కామన్ గా మనం హాస్పిటల్ క్యాంపస్ లో కూడా ఉంటుంది. పింక్ ఫ్లవర్స్ ఉంటుంది, వైట్ ఫ్లవర్స్ ఉంటుంది. నీరియం oleander and cerebra thevesia and cerebra and aconite and nicotine tobacco. These are the five, and along with this you can add this quinine also is a toxic cardiotoxic poison. And remember these are the six cardiotoxic poison: nerium oleander and cerebra thevesia. That is cerebra thevesia is the yellow flowers in nerium adi, and the cerebra borealum. In this the cerebral borealum, the fruit of this cerebra borealum is looking like a mango la ఉంటుంది. Flowers looking like the jasmine, cerebra borealum. And aconite is a monk's wood, bush or monk's wood antaru aconite anedi aconite. And nicotine and tobacco, you know. And the sixth one, quinine. Quinine, you can remember, it is used as a drug for the malaria, and it has its poisoning effects on cardiotoxic. So remember that there are the six cardiotoxic poisons you are going to read it. This is the nerium oleander. This is the commonly you can find in our campus also, the pink flowers and white flowers also there. And this is the lanceolate leaves also there. So these are white flower, nerium oleander. This is the cerebra thevesia, yellow flowers. The cerebra thevesia is the type of. And come to the cerebra borealum. This is the cerebra borealum. You can see the fruits of this plant looking like the mangoes in the greenish color, and the flowers in the white and looking like a jasmine flowers. So these are the toxic cerebra borealum, and flowers, the leaves are arranged in the lanceolate manner. So come to the this. What are the toxic principles and what are the effect of these three oleanders, especially nerium species? So oleander, nerium oleander, thevesia, cerebra thevesia, and cerebra borealum. So what are the differences between these three toxic cardiotoxic poisons? Okay, the synonyms of white oleander and oleander, nerium oleander, and cerebra thevesia, that is a yellow oleander, that's because of its flowers are yellow in color. and lucky nut and invest in this one. They will call it the lucky nut. And suicide tree. So cerebral vadal. Already we've seen that mango like fruits. Suicide tree. Otherwise, it's so come to the what are the active principles? I think you have to remember all these trees, all the parts of the plants are these plants are the toxic in nature. All the parts of the plant are toxic in nature. Now, what are the active principles in this? Come to the oleander, that is a nerin, and oleander is the active principles of the nerium oleander, and cerebra thewassia. The toxic principles in this cerebra thewassia are the thewitine, thewitoxin, and the nerifolin, isn't it? So these are the active principles, and we come to the cerebral vadalin, the cerebral and vadalin, and two active principles are there, and come to the all parts of the plant except root or poisonous in case of the oleander, and in case of cerebrothecia, all parts of plants are poisonous in nature, and in case of the cerebral vadalin, all parts of the plant are also poisonous. See, all the parts means that is the leaves, flowers, bark, and root. What are all the from all the parts of the plant you can extract this active principle. The active principle will be available in these all the parts, isn't it? In case of the iridium oleander, that in all the parts except the root is non-poisonous. Come to the fatal doses. In case of this cardiotoxic poison, especially these oleanders. The fatal dose is 5 to 15 leaves of nerium oleander, and the fatal period is 20 to 36 hours. That is 1 to 2 days, and 20 to 30 years. But in case of cerebral thewassia, 5 to 10 leaves, and or 5 to 8 leaves, cerebral thewassia. So, and fatal period is 2 to 3 hours. In case of cerebral thewassia, oleander, that is. So here the already we discussed that is the fruit is looking to the mango. That means one of the kernel of the one fruit is enough to cause the death of the kernel of the fruit. 1 to 2 days is the fatal period of in this case. So we can read like this: these three are cardiotoxic poisons are differences like this, and you go through the textbooks again, and you can make it up. Come to the clinical features whenever the person taking this poison accidentally suicidal. And what are the clinical features of these three plants? And observe, this is the first of all, whenever you taken by ingestion, means orally, it causes GI symptoms, nausea, difficulty in swallowing, and articulation and vomiting, abdominal pain, and frothy salivation. Diarrhea may be occur due to the gastric irritation. It may lead to severe gastric irritation. It leads to the diarrhea. And in case of the that means a CVS cardiovascular system, what happens? Symptoms are ventricular tachycardia and rapid and weak pulse, and may lead to the hypotension and atrioventricular block. This just and other muscular twitchings and lockjaw and tetanic spasm may be occurred in this case of the oleander. So nerium oleander, the poisons. And about the cerebral thewassia, yellow oleander, and the poisons by this is lead to the GI symptoms is burning in the mouth, burning sensation, and numbness and tingling of the tongue, and dryness of the throat, and vomiting and diarrhea. So cardiovascular system, you can see rapid and weak pulse and hypotension, heart blocks may be chances. And come to the as a giddiness and dilated pupils and muscular weakness may be occur. And come to the cerebrovascular. Here, symptoms are better taste whenever taken, and nausea, severe itching, vomiting, and abdominal pain, and severe cardiovascular system. The system are sinus bradycardia and sanitary block and hypotension. See, all these cardiovascular system hyperkalemia. You have to remember hyperkalemia, and you got to. And in general weakness, blurring of the vision, hyperkalemia, and a decreased transaminase activity. So this what I mean, what happens is it increases the potassium levels, hyperkalemia, but it depresses the transaminase activity. So by that muscular activity, that means muscular excitability will be increased in this. So it may lead to the tachycardia, fibrillation like that. This blocks. So these are the oleander and the thevesia and the cerebrovidalum. And come to the treatment aspect of this cardiotoxic poisons by these oleanders, isn't it? Look out to white oleander or odalum. What is the basic management of this cardiotoxic poison? You can remember. The treatment is, first of all, you have to remove the person from the source of the uh, that means poisoning, and you can uh, shift it into the fresh air, and or otherwise you have to immediately shift to the hospital casualty. So in that, the stomach wash with a potassium permanganate. Generally, 1 in 10,000 potassium permanganate is used in all the cases. Uh, Stomach wash with the potassium permanganate. Next, in this case only under symptomatic treatment for this antiarrhythmias and cardiac stimulants and IV fluids and the electrolyte to correct the electrolytes imbalance. See, in case of cerebral atheria, stomach wash is as usual, 1 in 10,000 potassium permanganate, right? Sodium lactate IV with the glucosic entry. So to combat the metabolic acidosis and increase of acidosis. So the sodium lactate you have to give the IV with glucose and symptomatic treatment. So next, in modern case also, to do the stomach wash with the same potassium permanganate, and you can give the atropine and correct the hyperkalemia also. So all these actually these cardiotoxic poison will have these poisons have the digitalis action. Digitalis poisons like these actions. Digitalis. So you can go for this discipline or digoxin antidote. Digoxin antidote. You can give the digoxin antidote discipline the term for this all these cardiac poison these oleanders. You go for the discipline digoxin. There is an antidote from this digoxin. You can give this discipline and so rarely they are used, but you can use it. You can antidote. Come to the autopsy findings when you're doing the postmortem examination completely, and definitely we will send it for the chemical analysis with Zira. And what are the typical findings in these cases? These are plant poison, that is cardiac poisons. In stomach gun, typical this is just internal organs congestion and scope. Are there chances of these uh, seeds maybe stick to the stomach mucosa in this case? Seeds, crushed powder of the seeds may be sticking to the stomach wall. Otherwise, there is no specific findings. That is specific findings and congestion of the internal organs and that congestion of the and the vision also like this. And in case of the vadalum, all asphyxial signs are there. All internal organs are congested. Come to the medical legal significance of this poison, cardiotoxic poisons, and the forensic significances. These are all the cardiotoxic poisons. These are a little bitter taste of them. So they may be used in suicidal poisons, and they may be mixed with the any honey, sugar, and mixed with that powder, and they will take as the suicidal poisons, isn't it? This is it. And at the same time, next illicit abortions, to procure the abortion and suicide homicide. The cattle poisons, arrow poisons, cardiotoxic poisons, and cattle poisons use as in general. And in case of Tevisha, criminal abortion and cattle poisons, as used as cattle poisons. And in case of Vodalum, it is ideal for homicide as difficult to detect in the autopsy. Best to ideal and that is aconite is the aconite. We will discuss that. Aconite is the best ideal homicidal poison. Not only this is, as there any ideal homicidal poison means they have some features, characteristic features, especially which should not detect in the autopsy. So what the toxin which is easily degradable by the putrefaction it is unstable form. So they cannot find in the post-mortem examination or in the chemical analysis. So a particular type of poison you can call it as the ideal homicidal poison. So easily available and they may cause the with less fatal dose with less time to cause the death of the individual, and they should not find in the post-mortem examination. It is difficult to detect in autopsy means it is an ideal. Generally, cerebrovagal also ideal homicide, but aconite is the ideal homicidal poison used generally. Okay, so suicide also is next. Come to the aconite. Aconite. It is the toxin produced by the aconitum plant. So aconitum plants are there. There are two species: the aconitum nerifolia and aconitum something like that. Okay, aconitum plant, which is also known as the devil's helmet or monkshood. So the flowers looking like the hoodlum. So it is otherwise called devil's helmet or monkshood. Previously used as an antipyretic and analgesic, but now he has the repeated use in the herbal medicine. So next, it grows in the Himalayas, and all parts of the plants are poisonous. Roots and ripened seeds are more potent, especially root. And this, what is the main part in aconite plant is means root is the main potent to poison, isn't it? All parts are poisonous, no doubt it, but mostly the root. We will take the root is the active poison in the aconite plant. So you can see this the flowers of the aconite in a purple color see, and the flowers are looking like the hood. That's why it's called the monk's hood now, or devil's helmet. Devil's helmet now. Okay, this is the aconite plant, and these are the seeds of the plant. And come to the what are the clinical symptoms whenever the aconitum plant taken as the poison? Aconitum plant is taken as the poison. The neurological symptoms and GD symptoms as usual they will take whenever taken by the mouth. It is causes the nausea, vomiting, and abdominal pain and diarrhea due to the severe gastric irritation. And neurological findings: anesthesia, numbness in the face, and perioral areas, and all the limbs shows the numbness. First of all, the adjustability numbness, but paresthesia numbness is the main face and the perioral areas and all limbs. Muscular weakness of the all limbs may be occurred. And come to the CVS system. So its action, that is equilibrium action on the cardiovascular system. It causes the hypotension, palpitation, chest pain, and sinus tachycardia, and ventricular arrhythmias and IV blocks. Isn't it? Okay. So and other dizziness and pallor and profuse sweating may occur. And entrance question, you have to remember the what is hippus? Hippus. Pupils alternately contract and dilatation of the pupils. You can come to the hippus, which is caused by the aconite poison. This is the entrance question. If you remember hippus, what is hippus? Pupils alternately contract and dilate. This is known as the hippus. It is seen in case of the aconite poison. At a stage, it remains dilated and the person will be dying. These are the clinical features of this aconite plant poison. If you remember, and especially cardiotoxic. This is hypotension, and palpitation, chest pain, and sinus cardia, and ventricular arrhythmias and everything. Up to now, there is no questions are given in this particular importance. You have to remember as a 2 mark question like this. Cardiotoxic. So now come to the what is the management? How to manage this cardiotoxic poison, especially aconite. So as usual, stomach wash with the warm water and tannic acid, and they can use the activated charcoal and give the atropine and symptomatic treatment. Further this symptomatic treatment and autopsy findings in case of the forensic significance. Nothing specific signs of accident will be uh, seen. The forensic significance of this is homicide mixed with the betel leaf and drinks lo mix చేసిస్తారు betel and mixed with the betel and ideal homicide. Already we discussed, and it is used as a criminal abortion to procure abortion. We will use the and used as the cattle poisons and to kill the cattle of the enemies. To take revenge over the enemies, they will use the as the cattle poison, and it will use as the arrow poison kills the birds or anything. So once again, you have to remember this ideal homicidal poison, and at the same time, ideal suicidal poison and ideal homicidal poisons. You have to remember. Any ideal means it is should be chiefly available, easily available, and the lethal dose should be very less. With less quantity only, it may leads to the death of the individual, and less time. Within less time, you have to die the person. And at the same time, after giving the poison, in case of the it is easily degradable, should not find in case of the chemical analysis should not find. So that means it is ideal poison, easily available, cheap, and less fatal dose and fatal period, and should not find in case of the chemical analysis. That means easily degradable. Seconite will be easily degradable and unstable product. So it can find, no one cannot find this poison in the uh, uh, chemical analysis. So that's why you can call it as the ideal homicidal poison. Is best one is aconite. After that is thallium. Thallium. Thallium is the another one ideal poison, which are fulfilling all these ideal poison criteria. Isn't it? Is the forensic significance of this aconite? And come to the another poison, that is the nicotine. Nicotine is the nicotine tobacco. It is extracted from that is the poison commonly used as in cigarettes and other ways. It is the toxic alcohol present in the tobacco and source of the leaves of nicotine tobacco, and dried leaves are processed to form a tobacco. So nicotine tobacco and nicotine is the active principle. The mechanism of action of this nicotine poison is first stimulate, then the depress the autonomic ganglia, and later blockage of this. So also acts on the somatic neuromuscular junction and afferent fibers from the sensory receptors. This action is the nicotine is the cardiotoxic poison, no doubt, and it may cause the stimulation first, then depression of the autonomic ganglion, and later blockage. That's why it may cause the cardiac block also. It also acts on the somatic neuromuscular junction and afferent fibers from the sensory receptors. Its action mechanism. This is the tobacco plant. You can see flower and the leaves is large in size, and these are the toxic. So these are leaves, the large in size, and that is the toxic principles most probably in case of leaf used as a tobacco. Okay, now come to the what are the clinical features of in case of the tobacco poisoning. See, the gastric almost 50 to 100 milligrams is the toxic. That means fatal dose. Whenever you take ingest the tobacco in a large quantity, which causes the burning acid sensation, nausea, vomiting, and hypersalivation, isn't it? And this cardiopulmonary effects of the nicotine toxin, it leads to the tachycardia, hypertension, and later bradycardia and hypotension, and respiratory depression and arrhythmias, that lead to the death of it. And the CNS system, sir, that is, it leads to the meiosis, constriction of the pupil, that is meiosis, confusion, headache, ataxia, restlessness, later convulsions and lethargy and cough. See, is the signs and symptoms of this poison by the nicotine. So chronic poison, that is chronically using these cigarettes, and like they will be habituated and addicted to this nicotine. They may cause the chronic poisoning, may lead to the cough, wheezing, anorexia, dyspnea, and who are using continuously that is cigars and tobacco, impaired memory and tremors. In the long run, they may cause the cough, wheezing, anorexia, dyspnea, impaired memory and tremors, and toxic amblyopia and extrasystolic. Is the chronic effects of the tobacco on the cardiovascular system and especially on the body. So whenever the person you want to stop the smoking, or it may cause the withdrawal symptoms. What are the withdrawal symptoms? Intense urge to smoke and anxiety, headache, muscle cramps, and sleep disturbances. These are the withdrawal symptoms. That's why they will give you the nicotine patches to replace the nicotine. Nicotine patches just to chew in, and it will be give some relief to the withdrawal symptoms. So treatment for this nicotine poisoning and acute poisoning, decontaminate the patient and remove the person from the source of the contamination and send it for the that means casualty, and treat the patient and the symptomatically. An antidote for this nicotine tobacco is the mecalamine. Mecalamine is the antidote. Is given in entrance question also. You have to remember for this, and mecalamine and atropine you can give, and oxygen and symptomatic treatment. In case of the chronic poisoning, the person who has withdrawal symptoms and nicotine patches, they will give for the chronic poisoning basis. So by withdrawal, we will stop the nicotine, and they will give the nicotine patch, replace that one to treat the patient in case of the poisoning. So, and autopsy findings in case of this nicotine poisoning, signs of asphyxia is there, hemorrhagic congestion of the GI tract and pulmonary edema. You can find this. So forensic treatment mostly accidentally, that is a person who are going to take a heavy smoking and ingestion of the some people they will be chewing and take the large amount of the leaf of the tobacco in the particularly previously in the old generation and in case of the villages also. So they will take accidentally, they undergo this poisoning, smoking, tobacco poisoning, and may lead to that. One of the commonest drugs of the abuse worldwide using is the nicotine tobacco as a in the form of a cigarette. One of the commonest drugs. Okay. With this, we finished these cardiotoxic poisons also. You have to remember spinal poisons and over and cardiotoxic poisons, especially nerium oleander, nerium cerebral aviation, and cerebral vadala, and aconite, and last one that is nicotine tobacco. And one more is quinine. It is the anti-malarial drug is used. Go and it sodium water quinine. It is also a quinine cardiotoxic. So with this, we finish the cardiotoxic poisons also. So spinal poisons and cardiotoxic poisons over. So we'll come with the next another topic in the next class. All of you can leave this. Thank you.